Already, our hospitals are feeling the manpower crunch. Signs of fatigue can be seen amongst our healthcare workers. It's been over 20 months of continuous daily battle against the pandemic. A large proportion of our healthcare workers have not had the opportunity to take leave since 2020. And over 90% of them, 90% of them, will not be able to clear their accumulated leave for 2021. This is clearly a much higher proportion compared to the past 2 years. Our healthcare workers have gone and continue to go way beyond the call of duty to care for their patients. The hospitals are trying to minimize having staff work overtime. For the month of September, our nurses worked for an average of 160 to 175 hours per month. I received a WhatsApp message from a senior member of the clinical teams. It says, "We are getting increasingly stretched, overworked and fatigued. We are uncertain how long we can keep this up. Morale is slipping." Another colleague sent me a WhatsApp message. He goes, "It feels like what started as a 2.4K run became a marathon, and just as we are reaching the finishing line, we have to run a second marathon. Our people are exhausted physically, mentally, emotionally, whether they will admit it or not." Whether they will admit it or not. I know this person as a professional colleague. I know both of them. Their roles to look after ICU patients also extends to looking after their staff, managing their teams, making sure that people are in a position and have the ability to perform at their best. So when people like them say words like this, exhausted physically, mentally, emotionally, whether they will admit it or not, I take it very, very seriously. It's therefore not surprising to find resignation rates going up this year. About 1,500 healthcare workers have resigned in the first half of 2021. 1,500 in the first half of 2021, compared to about 2,000 annually pre-pandemic. Foreign healthcare workers have also resigned in bigger numbers, especially when they are unable to travel to see their families back home. Close to 500 foreign doctors and nurses, healthcare workers, have resigned in the first half of 2021 as compared to around 500 in the whole of 2020 and around 600 in 2019, about double the usual rate. These resignations were mostly tendered for personal reasons, for migration or moving back to their home countries. But it is also in such trying circumstances that we find stories of inspiration, stories of commitment to public service. On a recent visit to a COVID-19 ICU, I met a nurse who had been redeployed from her usual job in the orthopedic department into the COVID-19 ICU. In orthopedic department, they look after bones, joints, muscles, and she was now redeployed into a COVID-19 ICU. She had had a short training and orientation course, and then subsequently on-the-job training from her ICU colleagues. She's senior. She's a nurse clinician, an advanced practice nurse, many, many decades in public service. And although it's a challenge to work in a new environment with a new set of equipment and drugs and protocols, because of her excellent fundamentals and her experience and her resolve, she demonstrated confidence and competence in delivering care that the ICU patients need. On the day that I visited, she was looking after her first ever obstetric patient. After many years, this is her first ever obstetric patient. A young lady who had to have her baby delivered prematurely because of COVID-19 and was now needing treatment in the COVID-19 ICU, not in the postnatal ward. An orthopedic nurse deployed to a COVID ICU, now looking after an obstetric patient. And there are many others like her, doctors, nurses, therapists, social workers, redeployed to do what is urgently needed. And despite having to do difficult work in unfamiliar environments, they have kept the clinical outcomes excellent through hard work, professionalism, dedication, and resilience. But this is taking a toll. They are getting tired. They are carrying a burden of care that is sometimes unimaginable. Having to hold a phone for a patient so that the family can say their last goodbyes. Holding their patient's hand to keep them company on behalf of the relatives. They need all the support we can give them.